The main thing that I tell people to pay attention to is your hemoglobin A1C. And it's usually around that 30-40 age that people get their hemoglobin A1C to begin creeping up. Diabetes is really, really important to catch early and to manage and to possibly reverse if you're pre-diabetic. So diabetes, hypertension are probably the most important things to actually pay attention to. Those are the most common things that we see start to creep in as people get a little bit older.
Everyday emergency physician, Dr. Valda Crowder, helps you make sense of the health questions people are asking in real life. When symptoms show up, diagnoses feel confusing, or medical advice starts to sound so overwhelming. But Dr. V finds a way to bring calm, clarity, and real-world insight from the front lines of emergency medicine. And now we're taking things a step further. What started as a podcast has now evolved into a full video and audio experience, giving you a new way to really connect with the conversation. And this is What the Health is Happening. I'm sure a lot of listeners already have been listening to Dr. V for some time, and I'm sure that there's a lot of new listeners now. So everyone, welcome. This is the first video episode of What the Health is Happening with Dr. V, a continuation of the podcast she's already been hosting for quite some time. So I'm excited to be part of this journey with her, and let's dive in. Dr. V, how excited are you for today's episode and for this new chapter of the show?
Excited to be here today. Yeah, I'm glad I could join you.
Awesome. I'm excited to dive into this. So Dr. V, let's start with the question that really inspired this show. So what do people usually mean when they ask, what is going on with my health, or what the health is happening?
So when people go, what the health is happening, it's usually like, it starts out with what the health is happening with my body, right? Because they may have been in great health or normal health, and then they suddenly have a change. And then when they go to make an appointment to go see their primary care doctor or their specialist, or they have to go to the hospital and be hospitalized or have surgery, sometimes they have experiences inside the healthcare system where they're like, what the health is going on over here in this healthcare system? And then I always have people who are also like, they go to the pharmacy, they're surprised by how much some of the medications cost. They may get a bill from the doctors that they saw, and they have another experience where they're kind of like, what is happening over here? So that's kind of what made me actually call the show What the Health is Happening.
Mm-hmm. I love that name. I think it's super catchy and it's so relevant. But I know that you've also spent years working in emergency medicine. So what does that experience really teach you about how people understand or even misunderstand their health?
So yeah, there's a lot of things. I mean, the emergency department, we see everyone despite their ability to pay. And when you go into an emergency department, we don't really have an established relationship. We're establishing the relationship with the patient right then and there when they're sort of most in their moment of need. And so, sometimes there's things that the patients are concerned about and I am concerned about, but sometimes there's things the patient's concerned about it, I'm not really concerned about it. Or sometimes the patient doesn't think something is serious, and I'm like, no, wait, this is serious. Don't step over that particular point or that particular symptom. So I think it's really a time when we can kind of both get on the same page about what's important, and also addressing what the patient thinks is important.
Absolutely. And I think just from obviously being on more of a patient standpoint, sometimes, like you said, we might think something's not important that is, and vice versa. So that's important to really actually listen to the guidance of professionals. And I think one of the biggest questions people have is, when should I actually worry about a symptom, right? We're just talking about what's important and what's not. But when is the time to really worry about a symptom? And what are some situations where people actually wait too long to seek help?
Yeah, so there's a lot of things, particularly around diagnoses around stroke, where people have like slurred speech, or they maybe have facial asymmetry. One side of their face is working and the other side of their face is not, or they get weakness in their arms or legs, that are stroke-like symptoms, or they may also just they may sort of have problems walking. So, when you talk about things like a stroke, I think people don't realize that it's really, really important you get in as soon as possible, because what we can treat you with depends upon how fast you got in. And similar situation with when people have chest pain or shortness of breath or suddenly get sweaty. Those are things that are like really, really important because they're signs of a heart attack. And that also makes a difference. What I can treat you with, you get in sooner. There are various treatment options. You get in later. Sometimes there are fewer treatment options. So, things that have to do with your cardiovascular health are really, really important as far as the timing of actually getting in. But I tell people, if the symptom is bothering you and causing you a lot of angst, come on in.
Hmm. Absolutely. I think it's very important to not wait on a lot of
Yeah.
symptoms that people definitely tend to wait on.
Yeah.
And what are some of the most common health questions that people ask you that you find surprising or that surprise you?
Oh, I would say one is like when I prescribe something and people go, "How big is the pill?" And I'm kind of surprised because I don't know how big the pills are that I prescribe. Right. And so, but apparently there's a lot of people that have problems swallowing large pills, right? And so, and I think the other question that I get a lot is, how can I get an appointment faster with my doctor or with the specialist? And I also get asked a lot about constipation. Yeah, so people are looking for solutions to constipation, which are often kind of related to their diet and things like that. But those are probably like the top three questions where I'm kind of like, okay, here we go.
So you kind of already know that those are going to be the most common questions. You tend to tell people similar things, or do you kind of base it on their individual health if you know that at that point?
So usually I base it upon what they actually have going on. Some people really have difficulty swallowing pills, so I'll tell them, would you like for me to put this in a liquid format? And if I put it in a liquid format, it may be a lot of volume, but at least you'll get it down. And similarly, if I'm dealing with people with constipation or other issues, I usually kind of try to figure out, what are you doing? What have you tried already? So I'm not giving them, advice that's something that they've already tried and maybe didn't work.
Absolutely. And I know that you've mentioned that a lot of younger parents reach out about their children's health. So, what are some of the biggest concerns that parents really have today?
Yeah, so I would say probably the biggest concern I get from parents is when their kid has like fever and vomiting. Right? Those are probably the biggest concerns. And one is sort of like properly dosing the Tylenol and the Motrin. A lot of times they'll underdose it and then they'll be concerned because the fever hasn't gone away. So, that's usually an issue. And then vomiting is usually a big issue with the kids. And you know, it can be difficult to watch a kid vomiting. Um, but that is something that the parents often come in with a lot of concerns.
Absolutely. And so that's more about children, but I know that you also deal with older people as well. So for people over the ages of 45 or 50 who are starting to really notice changes in their health, what are
Mhm.
some of the issues that they should really be paying attention to earlier on?
Well, the main thing that I tell people to pay attention to is your hemoglobin A1C. Right. And it's usually around that 30-40 age that people get their hemoglobin A1C to begin creeping up. Diabetes is really, really important to catch early and to manage, and to possibly reverse if you're pre-diabetic. So diabetes, and I would also add to that hypertension, are probably the most important things to actually pay attention to. And that would basically be your blood pressure and your hemoglobin A1C. Those are the most common things that we see start to creep in as people get a little bit older.
That's something that I have heard before, and I think that is something that people do tend to also put off a little bit. And one thing that a lot of people struggle with is really knowing where to go for care. So, how should people decide between primary care, urgent care, and when do you go to the emergency room?
Yeah. So let me, primary care is usually just, your regular checkup or your regular visit, or maybe a check-in for your medications or to check your blood pressure. It's important to know a lot of primary care doctors for adults don't necessarily have, um, what we call on the spot visits, right? Whereas a pediatrician will sometimes have a sick kid visit, right? And they'll have slots available for kids to come in. So I tell people the most important thing is if it's between the hours of 9 to 5, you can always call your doctor's office and they'll tell you immediately, we can see you for that or we can't see you for that. Um, the other thing is a lot of physician offices have nurses helplines. And the nurse helplines will also kind of direct you emergency department or urgent care or primary care. Urgent care is really different because all urgent cares are not the same. Many of them are very, very different. And so some urgent cares have the ability to do x-rays. Some of them do not. Some urgent cares have the ability to do blood tests. Some of them do not. So with urgent cares, you've really got to know, what is, what is the ability of that urgent care. And I would say, if you're thinking about going to urgent care, you want to make sure to call ahead of time and make sure they can do an x-ray or make sure they can do a blood test. And then obviously I tell people if you're uncertain, you can always go to your nearest emergency department. That is, and if you show up at an urgent care center or you show up at your primary care doctor's office and you really should be at the emergency department, they will get you out of there. They will get you out of there and call an ambulance and get you to us. And usually call ahead and tell us that you're coming and tell us what's going on. So I think it's more important when you're not sick to figure out, does my primary care doctor have sick visits? But the urgent cares in my neighborhood, which ones are able to do what, right? So you kind of know before you get sick what the capabilities of those offices are, because it can be kind of confusing when you're in the midst of whatever the crisis or situation is.
Absolutely. And I know we talked a little bit in the beginning of the episode of what the health is happening, but I want to know what listeners can really expect to hear and learn from this podcast.
So the main thing is we're going to decipher all of the things that you experience when you interface with the healthcare system. So we're going to talk about all of it. And I have people send in topics. I've had a lot of people send in topics because they wanted to know about certain things. So we're going to talk about all of it.
Absolutely. And this is what I meant to say earlier. We talked about a little bit in the beginning about what inspired you for this show. But there's anything else that comes to mind that really made you think, I get these questions all the time. I have this knowledge, but was there anything that really inspired you to really want to start the show?
Yeah, the main thing that inspired me was during COVID, I started doing Zoom calls for my family. Because my family, part of them was in the Northeast and part of my family was in the South, and they had different understandings of COVID and they were confused about what they should do. So I started the Zoom calls during COVID for my family. Then they started inviting other people. And then folks started asking other questions other than COVID. And it went on for like a year and a half. And, next thing you know, we had, 5,000 or 6,000 people on these calls. And so then I was like, okay, well, why don't we just make this a podcast? And then I just have to say it once.
That's efficient.
Yes, exactly.
It's efficient and it reaches so many more people who
it's efficient and it reaches everybody. And there we go. You got it.
Absolutely.
And you asked and you wanted to know, and here's the answer.
There you go. Absolutely. Well, I love that that's the reason behind it. And I guess I just want to know you a little bit better too. So how did you get into this field and this career prior to wanting to start the podcast? But even in your journey, how did you really get to start doing medicine at all?
Well, I really admired growing up my pediatrician. I thought she was so magical because I would go in there feeling sick as a kid. And, the next day after seeing her, I'd feel better. And I always thought that that was such a great gift. And so, I originally, because I admired her, I thought I wanted to go into pediatrics. And so I went into, and I specifically thought I wanted to go into NICU care, neonatal ICU. And then when I got into medical school and I started seeing the different professions and rounding in the different departments, I realized I liked the excitement of the emergency department. I like never knowing what's coming in the door. No day is ever the same day. Do you know what I mean? And so I kind of like the variety of the emergency department, and I like dealing with, acute care patients, trauma patients, all of those sorts of things. And so yeah, that's how I wound up. But it started with me really admiring my pediatrician and what she was able to do for me. That's kind of how it started.
That's funny. I have very fond memories of my pediatrician as well. I, to this day, still think about her.
Yeah, right. They hold a little special place. It's almost like, the grandma or grandpa, you know what I mean? They hold a special place.
Absolutely. I remember when I aged out of seeing her. It was really sad.
Mine kept seeing me until she saw me through medical school.
Wow.
She was like, "Oh no, you come on in here."
I love that. And I have a question too about emergency care, because we talked about parents and young children and also people over the age of 40. So do you see all patients patients, I should say, of all ages?
Everybody, all comers. Yes, all comers. We've had emergency births in the emergency department. Yeah, we see everything from the beginning to the end.
Absolutely. So I know that this podcast is going to include everything from young to old and everything in between. Like you said, no day is the same. I think that this episode will have a theme, but no questions will be the same. They'll be full of new information every time.
Absolutely. Absolutely.
Also, Dr. V, I previously asked what are some of the most common health questions that people ask you that surprise you, but what are some things that patients tend to get confused by?
I would say one of the things that I see a lot that they get confused by is kind of like, what is the difference between like pre-diabetes versus diabetes? Where and I think that people get confused by that. We're going to do an episode on that. The other thing people often get confused about is their hemoglobin versus their hemoglobin A1C. And, your regular hemoglobin is telling you your blood count and telling you whether or not you have anemia. Whereas your hemoglobin A1C is telling you about your blood glucose. So people kind of get that confused because they kind of sound similar. So those are the type of things that I see people kind of get confused about.
Absolutely. And I think that that's so good that we are having this conversation on this podcast, because I know for a fact a lot of people are confused about that just from me having worked in some sort of healthcare administration and things like that. So I think that's great that you're going to shed so much light on commonly confused questions as well, and things that patients and people that are not able to maybe even see a doctor or see their doctor enough have questions about. So I think that's so important. For anyone listening, if you've ever wondered what the health is happening with your body, this show is here to help bring clarity. And also, if you enjoyed this episode, make sure to follow the show so you don't miss any future conversations. And thanks for everyone for listening to the first episode of What the Health is Happening with Dr. V. And I cannot wait to continue the conversations. I think this is going to be a really fun and informative show. So thank you so much, Dr. V. And we'll see you next time.